So today I'm going to present about meniscus injury. What is meniscus injury? Meniscus injury are among the most common knee injuries. Athletes, particularly who play sports like hockey or football, are at risk of this injury. However, anyone at any age also can experience this pain. What is meniscus? Meniscus is a piece of cartilage of knee that cushions and stabilizes the joint. It also protects the bones from wear and tear. Four types of meniscus injury. First is bucket tear, radial tear, flap tear, and degenerative tear.
Bucket-handle meniscus tear is typically large in size and involves the outer portion of the meniscus. Usually, it occurs when the knee is forcefully twisted and flexed. This causes the femur bone to catch the meniscus and tear it apart. Often, the inner portion of the meniscus displaces in front of the femur, locking the knee in a flexed position. This tear pattern is called a bucket-handle meniscus tear because it resembles the handle of a bucket.
And in this view, we can see the medial meniscus over here. This little black wedge fits between the femur, which is round, the flat tibia here. This is the lateral meniscus, and this patient has a lateral meniscus tear. So if we go backwards, the meniscus looks nice and triangular. If we go forwards, we get to this cut right here, just a single cut, where it doesn't look quite right. So it looks great, and then right there. So this is a tear that's oriented in this plane, this sliced plane. It's called a radial tear.
The parrot beak, if the tear is bigger, it can be a flap, and then it can be a displaced flap that causes mechanical symptoms.
So the last one is degenerative meniscus. Degenerative meniscus happen among the older people. So when you are getting older, your tissue is more prone to tear. How meniscus injury can happen? First, acute meniscus injury often happen during playing sports like football or hockey, as well as non-contact sport like jumping and cutting such as volleyball and soccer. For people that getting older, they are more likely to get degenerative meniscus injury. Also, an awkward twist from getting up from the chair may be enough cause a tear in aging meniscus. Other than that, meniscus injury can also happen when you kneel, squat, or lifting something heavy. What are the symptoms of meniscus injury? First, of course, you will feel pain. Second, you also feel stiffness or swelling. Third, your knee is feel like catching or locking. Fourth, the sensation of your knee giving away and inability to move your knee through its full range of motion. You might also feel pop when you tear your knee. However, people with this injury still able to walk, and most of the athletes also are able to play sport with this injury. But 2 to 3 days, the injury will become more stiffness and swelling. So, for the further examination, you have to see a doctor to know about the level of the meniscus injury that you experience. So, there are 3 levels of meniscus injury. Level 1 and level 2 is a mild, which is no need any surgery, but level 3 you probably need surgery. So that's why we need to do the doctor examination. So there are 2 types of doctor examination. The first one is physical examination. The second one is imaging test.
Meniscal tears, physical tests. McMurray test. Patient lies supine. Flex the knee maximally. Hold the foot, grasping the heel with one hand. Then hold the knee joint with the other hand, placing your fingers along the medial joint line to assess medial meniscus and lateral joint line to assess lateral meniscus. For the medial meniscus, rotate the tibia laterally together with a valgus force and at the same time extend the knee. For the lateral meniscus, rotate the tibia medially together with a varus force and at the same time extend the knee. Positive test result. When the patient feels pain and there is an audible or palpable snap, click or thud during extension movement. Thesali test. Holding patient's outstretched hands, the patient stands on one leg, the injured leg, with the knee flexed to 20 degrees and foot flat on the ground. The patient then rotates their knee and body medially and laterally 3 times, keeping the knee at 20 degrees flexion. Positive test result. When the patient experiences medial or lateral joint line pain.
Next is imaging tests. Imaging tests have 2. One is X-ray, second is MRI. First, X-ray. X-rays provide images of dense structure, which is bone. Although an X-ray will not show meniscus tear, your doctor may order one to look for other causes of knee pain, such as osteoarthritis. Next imaging test is MRI, magnetic resonance imaging scan. This scan can access the soft tissue in your knee joint, including the meniscus, ligaments, tendons, and cartilage. A doctor will look at here with an arthroscope. The function of arthroscope is to allow the doctor to see inside the joint. The arthroscope is a thin tool which has camera and lights.
Xavi, assistència de Xavi, més cap a la dreta per Messi, Messi, immens Messi, encara Messi, increïble, no m'ho puc imaginar, no m'ho podia imaginar, no ho he vist mai això, no ho he vist mai.
Okay, when happen something like this in the sport, so what should we do is not Dr. ABC for this. First we should do is stop. So what is S for the first one is stop. So we stop the game first and let's check out of the victim. Then we go to the next step is which is T, is talking to the victim. Hey, what happened?
I don't know.
Where you got sprained?
On my knee.
Oh, on your knee. So now we know he got sprained on knee. And then we move to the next, which is observe. Now we observe the knee and we try to see if this knee have any bleeding or swallow. So then we see this knee are not bleeding and this knee just a swallow, and we try to touch it and let's see what her response. So that means his knee is got injury. So next we should bring the victim to the outside to the field. We go to the next treatment. So now let's pick up the victim. Okay, can you up?
Yes, I can.
Okay, we should carry the victim like this because his leg is on the left, so we should carry him on the left. Now let's go outside of the field for the next treatment. Now we move to the next step, which is P from the top, which is P, prevention. Now we need to prevent any danger or any further injury happen. First, then we should do rise. The first one, rise, is R. R is for rest. We need to rest the victim because we don't want to the swallow more bigger or he feel more pain. Okay, next is I. We should put ice to the victim at the swallow because we want to treat this pain. Now put the ice the part of the pain. For example, this man got injury at the knee, so we put the ice at the knee. Next is C, compression, which is we need to compress the swallow or the sprain at the knee. Use the bandage, but we don't do it for this time because we put the ice. Okay. After we put the ice, as you can see, we can move to the next next step, which is C, compression. We need to wrap the ice with the leg to make sure the ice not fell down or fell off to this swallow. Then we wrap it to make sure it's more tight and hold this ice at the knees. After we finish doing this wrap, we move to the next step, which is elevation. We need to put the sprain or the knees, because the knee is injury, higher than your body. So we just, because we don't have any pillow, we use the cool box to put the sprain higher than the body. Doing this because we want to reduce the pain. Okay, after we finish doing this treatment, we now just wait and see the patient and wait for the next treatment, which is at the hospital. Okay, that's all for the first aid to the someone got sprain injury at the knees. Okay.
Okay, now let's talk about the treatment after we got the meniscus injury. Okay, now this treatment we do at our home. So what should we do is also the same thing, which is rise. What is rise? Like I said before, R is stand for rest, I is stand for ice, C is stand for compress, and E is stand for elevation. Okay. Now for the rest, which is we should need to rest our knee. How we need to rest our knee? We should limit our walking, and if we need to walk, we also can use crutches to help we reduce our pain at the knee. Okay. Next is ice. This ice we need to do often, which is we need to do for 15 to 20 minutes. Then for one day we need to do for 5 hours, and then after 5 hours we need to do it again. So we do this until the pain and swelling at our knee is gone. Okay, the next is compress. When we at home, we need to always wrap our knee using the bandage or using a K-tape or strapping to make our knee is compressed and to make sure to reduce the pain and swelling at our knee. Next is elevate. So you need to elevate your knee using a pillow under your heel when you are sitting down or you are lying down. If doctor give you a medicine, you can take the pill or medicine that are given by doctor to reduce your pain and your swelling at the knee. Okay, for the recovery process for our meniscus tear or meniscus injury, we also can do some sort of exercise. Now, what the exercise we can do. Now let's see the video.
I woke up with another siren in my mind. I can't decide if I was dreaming or alive. There's something circling the water where I'm swimming. Smoking weed is telling me the demon isn't winning. But girl, I'ma tell you what's next. I could play the role filler if you really want that. I could be the one that you're gonna wanna want back. Even if I read into it deep, I got the combat ready on lock for you. I'm watching all the clocks, but the talk of the ticking hand stop for you. I'll write the plot for you, but won't implement an ending. My eyes are realizing what I'm witnessing is tempting, but let me recollect myself first. My lids are dropping low like that DG self-worth. I'm only under 20, gotta learn how health works. Maybe when I do, then she'll cast me. I could play the role, cinematic and she know, she could probably cast whoever, but give me the lead and we'll last together. I could play the role, cinematic and she know, she could probably cast whoever, but give me the lead and we'll last together.
Trust issues she got, only sipping Ciroc. Spent more than she made, now she doesn't like what she bought. Stressing over the luxurious things, but all the diamonds in the world doesn't make up a queen. Call me 19 times tonight, don't tell me you're fine. You got a beautiful smile, but a perfect disguise. Said you gotta pay rent and the money ain't on time, and your man just left and leave a dollar sign. Well, you know I got it, I'm on it on what you need. You say your life is a movie, I guess you're needing a lead. And I can play the part, stay your heart, wait and you'll see. So tell me girl, who finna fit the part better than me? Lois Lane, I'm your Superman, promise I'm the better man. Hand in hand together, we're better than anybody, and things happen is the only way to word it. Nothing's made perfect, every moment make it worth it.
I could play the role,
Yeah.
cinematic and she know,
Ivan B.
She could probably cast whoever, but give me the lead and we'll last together. I could play the role, cinematic and she know, she could probably cast whoever, but
Okay, that's some of sort of the exercise we can do for the recovery our meniscus injury. Okay, but remember, if the pain is very sick, we need to do with the low intensity until our pain is getting reduced or getting lost, so we can plus the intensity. Okay, make sure use the correct intensity for your meniscus recovery and see the doctor or your rehabilitation doctor. Okay, that's all. Okay, now let's talk about the prevention of the meniscus injury. Okay, what is the prevention of meniscus injury? Okay, the first one, you need to maintain your flexibility. How we need to maintain the flexibility is we must do the flexibility exercise to maintain our flexibility. Okay. Next is we need to do some warm-up activity first before we taking part in game. Next is give your body time to rest between the workout. Okay, and lastly, if we doing the exercise at our knee or workout at using our knee, and then you need to increase the intensity, make sure change the intensity slowly. Do not do it fastly because your knee will getting pain or injury. Okay, that's all for the prevention of meniscus injury. Thank you.
I will proceed our presentation about knee ligament. There are 4 major ligaments in the knee. Ligaments are elastic band of tissue that connect bones to each other and provide stability and strength to the joint. The 4 main ligaments in the knee connect the femur, which is thigh bone, to the tibia, which is shin bone. First is anterior cruciate ligament, which is ACL, the ligament located in the center of the knee that controls rotation and forward movement of the tibia. The second one is posterior cruciate ligament, which is PCL, the ligament located in the back of the knee that control backward movement of the tibia. The third one is medial collateral ligament, MCL, the ligament that gives stability to the inner knee. And then the last one is lateral collateral ligament, LCL, the ligament that gives stability to the outer knee. ACL injury is one of the common injury. ACL injury is a tear or sprain of the ACL. ACL injury most common occur during sports that involve sudden stop or change in direction, jumping and landing, such as soccer, basketball, or downhill skiing. Now, let's move to the symptoms. Sign and symptom of ACL usually include: first, a loud pop or a popping sensation in the knee, but it doesn't happen to everyone. Second, severe pain and inability to continue activity. If you have a minor injury, you may not feel pain. You may feel sore along your knees joint line. Third, rapid swelling. This is most likely to happen during the first 24 hours. Fourth, loss of range of motion. After you damage your ACL, it's very likely that you won't be able to bend and flex your knee like you normally would. And then the last one is a feeling of instability or giving way with weight bearing. For the mechanism of injury, 30% of the cases is direct contact and 70% of the cases are non-contact. Mostly it is a non-contact declaration where the athlete suddenly turns to the opposite side of the planted knee and injuries it. Let's move to the grades of injury. Injured ligaments are considered sprain and are graded on a severity scale. For the grade 1 sprain, the ligaments is mildly damaged in a grade 1 sprain. It has been slightly stretched but is still able to keep the knee joint stable. For the grade 2 sprain, a grade 2 sprain stretch the ligament to the point where it becomes loose. This is often referred to as a partial tear of the ligament. For the grade 3 sprain, this type of sprain is most commonly referred to as a complete tear of the ligament. The ligament has been split into 2 pieces and the knee joint is unstable. So let's move to the causes. ACL injuries often happen during sports and fitness activities that can put stress on the knee. So the first causes is when an athlete suddenly slowing down and changing direction, landing awkwardly from a jump such as when jumping in volleyball or basketball, stopping suddenly from running, which can cause the ligament to hyperextend. And then the last one is receiving a direct blow to the knee or having a collision such as football tackle. So for the risk factors, there are a number of factors that increase your risk of an ACL injury. First, participating in certain sports such as soccer, football, basketball, gymnastics, and downhill skiing. Second, poor conditioning. Third, using faulty movement patterns such as moving the knee inward during a squat. Fourth, wearing footwear that doesn't fit properly Then the last one is using poorly maintained sport equipment such as ski bindings and they are adjusted properly.
زمبروتا مترازي الى المنطقة الامامية والكرة ملعوبة تتصلح لبيرلو بيحاول يغير راية فيها وتلعب وجول الله وخطرة جول لا 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 انقلاب في ملعب المباراة.
Okay, when we see this happen on a field or when they're playing game, first we must do on-field assessment, which is stop. For the first one is S stop. So any playing game, we must stop and we check for victim. And then for the T is talk. When we talk to our patient or victim, we ask them if it's okay and where the pain that he feels. So where you feel pain or in the knee, and then we also observe and we touch if and if victim give a response for that place, which is that place must have injured. So after we observe and then we do a prevention. With the prevention, we take our victim to outside of field and stop the game. And then after we do prevention, and then we do next step, which is we call it rise. For the first letter is R, is rest. We must rest our victim. For the second letter is ice. We can put the ice on the injured place, which is for my victim. The injured place is on the knee, so we put the ice on that place so it can reduce pain. And then for the next letter is C, which is compression. For the compression, we can wrap our victim knee using a bandage or plastic wrapping. So for example, I use a bandage, so I can wrap this place to reduce any pain, so my victim can't feel any pain. And then after that, for the last letter, which is E, elevation. Elevation, we can put down our victim knee, and then we can put a pillow, or for now we don't have pillow, so we can use this school box. So we put under our victim knee, and then after this we wait for the ambulance for the next step, which is we can do another treatment, such as special treatment, to know whether what type of injured that our victim have. For example, like meniscus or ACL or other knee pain. So we wait for the ambulance, and then we make sure we always check our victim. Okay, for further treatment, patient have to do examination of ACL. It can be done in two ways, which is physical or clinical, and examination under anesthesia or arthroscopy. Doctor will do a special test, which is attachment test, to identify the integrity of anterior cruciate ligament, which is ACL.
Anterior femur with the outside hand and grasps the proximal tibia with the inside hand, with thumb on the tibial tuberosity. An anterior stress is then applied to the tibia on the femur. A positive test is indicated by anterior tibial translation or by disappearance of the infrapatellar tendon slope. These signs may represent a tear of the anterior cruciate ligament.
After that, doctor will do a diagnosis. If the result from special test is not good, an exact diagnosis can be made by the following of this procedure.
and then doctor will recommend you to do a surgical or not doing a surgical. Doctor will recommend you to do a surgical if more than one ligament or fibrous cartilage in the knee are injured. For non-surgical treatment, it includes bracing and physical treatment. And then you must go through rehabilitation. Physical therapist will teach you the exercise that you will perform either with continued supervision or at home. And the goal of rehabilitation is to reduce pain and swelling, or to restore your knees motion and strengthen your muscle. And the physiotherapy intervention could be divided in 4 phases, which is acute stage, pre-surgical or conservative treatment, after surgical stage, and then return to the spot. Okay, for prevention, you should be especially mindful of 2 things, which is how you take hard, quick step to accelerate in another direction or cut, and how you land on your feet from jumping. And then after that, various training technique can minimize the risk of tearing the ACL. And implementing an ACL prevention program, there's a 5 key steps that should be included in the planning of this program, which is the first is identification, second exercise, third training load and volume, fourth is training frequency, and the last one is exercise training or exercise timing.